I'd like to call to order the meeting of the Social Services Committee. First on the agenda, we're going to approve previous minutes. Motion, Mr. White. Second. All in favor?
Aye.
Opposed? Passed unanimous. Okay, on to current business. Number 1, authorizing the renewal of a grant agreement with the New York State Office of Children and Family Services for the Children's Advocacy Center, Child Fatality Review Team, and amending the 2019 Department for Children, Youth, and Families budget. Commissioner Cahagan.
Yes, good evening, everyone. The department requests approval to accept the funding from the Office of Children and Family Services regarding the Child Fatality Review Team. The Child Fatality Review Team is comprised of multiple stakeholders across systems with really the goal of reviewing fatalities to be able to provide recommendations in regards to how going forward we might be able to mitigate and address fatalities, in particular in the areas such as unsafe sleep, being able to provide recommendations back in regards to how to minimize the numbers of those really getting to the point of not having fatalities of those natures. The Child Fatality Review Team, in addition to providing recommendation, is also very much involved in terms of education and awareness, in terms of looking at safe sleep, in terms of in the summer looking at bicycle prevention and pool safety. So really the goal is really to be able to really provide feedback in regards to how we can look at really being able to get to a point where these fatalities that are preventable, how we can get education and awareness to the community to be able to address those.
Thank you. Are there any questions from the committee? Mr. Bullock?
The fatalities with biking incidents is way up. I was wondering, what age does this extend to? I mean, because a lot of older folks are driving things.
Well, I will say that because it's the Child Fatality Review Team and the funding is through the Office of Children and Family Services, in terms of like bicycle helmets, it is geared towards children, but certainly we can work with other groups in the community to be able to be more comprehensive in terms of the messaging and education and awareness.
You can work with the Bicycle Coalition.
Absolutely.
Okay.
Any other questions?
I'll make the motion.
Second. Approved. Second. All in favor?
Aye.
Opposed? Passed unanimously.
Thank you.
Thank you. Good night. Okay, number 2 on the agenda, authorizing an agreement with Interfaith Partnership for the Homeless regarding emergency and transitional shelter services.
Good evening. We're requesting permission to enter into a continuing contract with Interfaith Partnership for the Homeless for their 30-bed temporary housing facility. This facility houses both males and females, single individuals. They have handicap accessibility at this facility. They also have one single room that is set aside for people who are potentially at risk, such as people who are developmentally delayed or transgender. And this contract is for $602,000, and it is a 65% county share, 33% state, 2% federal.
Thank you. How much is paid per night per person?
We don't do a per diem for the homeless shelters. We have contracts that that make them whole, so they get the $602,000 per year. They bill monthly for these beds. So we pay them so that they'll keep the beds available for people when we need them. And yeah, so.
Okay.
And there is a performance-based component to all of these contracts that are coming before you tonight. So case management, developing independent living plans, that's also part of their contract that they have to do with every person that comes through their shelter.
And how do you measure the performance?
Well, we have milestones that they're supposed to meet. So for each person, it's developed differently. So every person that comes in and stays more than a night or two, people that come in just for a night or two, not much happens except to try to get an intake and determine why they're homeless and where they came from and that kind of thing. But for people that are there for a week, 2 weeks, up to a month potentially, they start looking at how they became homeless. Do they have mental health issues, substance abuse issues, making referrals for treatment in those areas, looking at their budgeting, their finances. Have they applied for benefits that they might be eligible for, or disability, those kinds of things. So looking at, the milestones are how many people did you intake, how many people did you assess for substance abuse, for mental health, for budgeting issues, for what their finances are, and then the goal is to get them into permanent housing. That's the ultimate goal. So, so we go through steps for each person to ultimately, hopefully, get them into permanent housing.
Okay. Can you provide us with that?
Yeah, there's actually, I think contracts were attached to the RLA. And in those contracts are the milestones. I have a sample here for the Altamont program. But if you need a hard copy, I can get that to you. Just didn't see it? Okay.
No, it's not.
We have that one, yeah.
Not in here.
Most of them are in the backup.
The exhibit, it's exhibit 1 is,
Okay.
I think it's 1. Yeah, there's, the milestones are in the exhibit. Do you have that, or do you need the
I don't
copy?
think I do.
We have a map in the back.
I think
Oh,
we're gonna have to
back,
get that
okay.
and hand that
In a hard
out.
copy?
Yeah.
Yeah, I can get that to you.
Thank you.
But we're actually in the process, we've been meeting with all of the shelters in the last couple months, and we're updating these milestones. For these contracts that we're talking about tonight, we are going to have some additional milestones, some more clear milestones. We're really looking at how we can work with the shelters to get some more outcomes and some better outcomes. So they'll be changing, actually, and I'll keep you informed of that.
Thank you. Is the information that we have, do we have past performance? Like, for example, last year's, which milestones were met, which ones weren't?
I have, yeah, we get
Information exists?
quarterly reports from the,
Okay, we have, okay, thank you. Ms. Lockhart?
Thank you. When you say, where do typically people, when they leave the shelter, after their time with the shelter, typically where are they going?
they might go into, there's transitional housing programs. A lot of the folks that come through need extra support. So they're not necessarily going to go into a private apartment, although that's a certain percentage that we try to find people private apartments.
Isn't that low though because of the population that you're dealing with? That
Right, there's not, they don't
the
have a lot of
permanent housing.
resources, number one, and sometimes they'll have behavioral problems that if we do get them into an apartment, it doesn't necessarily last that long. So there's supportive housing programs, there's public housing, there's transitional residences, there's residence for people who have substance abuse problems, so it depends on what that person's needs are and what's available.
Do you, one more question if I may?
Sure.
Do you have any numbers on how many sane people enter the shelter?
How many
You know,
what?
whereas Patty Lockhart returning to the shelter 12 times in a year, or, you know. Do you have those kinds of numbers?
We've been trying to dig down into that because there's so many shelters.
Yeah.
It's hard to keep track because people go to different
different
shelters,
ones, right.
and even within the same week, they could go to multiple shelters. So we're actually, as we're doing these new milestones, we're working with the shelters to get a better handle on duplication and people traveling. And we know, we get reports every night from the on-call service, and we see the same names multiple
Right,
times.
because they
Yeah.
identify them to you.
Yeah,
who
but
it
then a
is.
lot of people just come through and they're gone, and they don't come back.
Right.
So it's mixed.
Thank you.
Mr. Bullock?
And I assume emergency means code blue and things like that, right? Go ahead.
There's Code Blue, which I have a grant coming next. But Code Blue is, yes, when it's under 32 degrees, but we must shelter people, we must provide temporary housing assistance all year round.
I saw you use motels here. Now, what motels are you using? I didn't see a list.
I can get that for you. I think I know, it's Red Carpet Inn, it's Motel 6, it's
get your list.
Tompkins, it's, yeah, so,
I just don't want any of the old ones that we just.
no. And we try not to use them unless it's a last resort.
And those aren't for families? You don't put families in?
Generally not, that on occasion, there could be a family that we do.
Thank you.
Are there any other questions from the committee? Okay, can I get a motion to approve? Mr. Camiso, second Mr. Clay, all in favor? Opposed? Passed unanimous. Number 3, authorizing the submission of a grant application and agreement with the New York State Office of Temporary Disability Assistance and Interfaith Partnership for the Homeless.
Yes, this is, we're requesting permission to accept a state grant to fund additional services that occur during the Code Blue season. This is a 100% state grant that's provided to us and our providers to provide enhanced services during the Code Blue season. One is for, the total grant's $198,000. 162 is going to Interfaith for their Safe Haven Center, which is really a kind of an overflow shelter, or a shelter for people who may not be accepted in other shelters, who may be actively using drugs or alcohol, who may be having behavioral problems or that kind of thing. And then they also operate on the weekends or during the day as a warming shelter during Code Blue. So that's extra services that they're providing. We also have close to 21,000 for Homeless and Travelers Aid to be to provide extra services, walk-in services from 4 to 7, and provide transportation. They're using Uber, Lyft, buses, things like that to get people to shelters at night. And then we've asked for $15,000 for motel expenses, which are above and beyond kind of what we normally do through our shelters. But since we're required to place everyone during Code Blue, this has become an extra expense for us, so we're asking for $15,000 from the state to do that.
Thank you. Are there any questions from the committee? Okay, hearing none, motion to approve. Mr. Bullock. Second. Mr. Camiso, all in favor? All opposed? Passed unanimous. Number 4, authorizing an agreement with St. Catharines Center for Children, Marillac residents, regarding the provision of family shelter services.
Yes, we're asking for authorization to renew a contract with St. Catharines to operate their Marillac Center, which is a Tier 2 certified, New York State certified shelter, which means they're overseen by New York State, they're inspected, and they must meet certain criteria to be a Tier 2 shelter. They offer more intensive services to families. So this is 100% federal reimbursement. These are families who have been previously homeless, and they work with them more intensely and potentially over a longer period of time than some of our other shelters. This one does have a per diem rate at $145 per diem. And I think that's it.
Okay. You said $145?
Per day, yeah.
How come this one goes with the per diem structure while the other?
This is, it's really a New York State managed facility, and New York State often will do their reimbursement through a per diem. And this is basically kind of a pass-through for the county to the Marillac shelter. Although we do make referrals there, we have some oversight, we do some inspections there, we work with them to take our families and that kind of thing. But this is a certified shelter, different than the Tier 1 shelters, which are the rest of the shelters we're talking about.
Do we prefer one way or the other? Do we feel it's better to have a per diem, or better to have a just a lump sum fee? Or
well, that's a really big discussion item, I think, and we're having some internal discussions ourselves about what is best. I mean, we appreciate having these shelters here when we need them, and that they're fully whole and operational, so that we can refer people when we need to have them, and they're going to be there for us. So that's one angle.
Okay. Thank you. Are there any questions from the committee? Okay, motion to approve? Mr. Clay, second. All in favor? Opposed? Passed unanimous. Number 5, authorizing an agreement with the Altamont Program, Inc. regarding emergency and transitional shelter services.
Yes, this is to renew a contract with the Schuyler Inn. They hold 60 rooms for Albany County primarily for families, although we have used them for certain singles as well if we need the space and they have space available. Rather than putting people in hotels, we'll use the Schuyler Inn. And they offer, on-site services, 3 meals a day there. They help liaison with school districts, work on transportation, special problems that families might have. So they're charged with doing a little bit more work around the family unit and taking care of the children as opposed to some of the other shelters which are just singles. So this is 90% federal, 4% state, 6% county, and a contract of $1.3 million.
Thank you. Are there any questions from the committee?
Just
Questions?
as
Ms. Locker?
Commissioner replied to this, but also to the other ones, how are we doing with the inspections on these places that we're putting people? Are they being done on a monthly basis?
No, not monthly. The state requires every 6 months.
Every 6 months?
And the state is actually going out themselves.
Oh, okay.
And then they do the inspections. That has shifted in the last couple of years.
Yeah, there was a
The
big
state has
problem with
really
that.
taken over the inspection of the facilities. They give us the report, and we're required to follow up.
Okay.
So they do the initial inspection, and then we make sure that it's done, that's our job in that.
Does that seem to be working better than,
Well, yeah, they're a little nitpicky sometimes. I think some of the things that they ask some of the shelters to do can be difficult and expensive, but they're all doing it. They're all coming up. They've all complied.
well, does the state do the hotel shelters too when we use
No.
them?
No, they do
We're
not.
doing those.
We do the hotels, and also we rely on the code enforcement and fire. I mean, the regular things that motels have to respond to.
Okay. Thank you.
Are there any other questions? Motion to approve. Second. All in favor? Opposed? Passed unanimous. Number 6, authorizing an agreement with St. Peter's Addiction Recovery Center, Inc. regarding emergency and transitional shelter services.
Yes, we're asking for authorization to renew a contract with Spark for an 11-bed shelter. This is 9 males, 2 females. This shelter tends to have an expertise in substance abuse issues, so we will refer some of our folks that have more substance abuse problems to Spark and also mental health problems, and they kind of have a expertise in there and in handling those kinds of issues and getting people hooked up with services that are needed. This is 33% state, 67% county. These are singles. And the contract amount is $244,000.
Thank you. Are there any questions from the committee? Okay, hearing none, motion to approve. Second. All in favor?
Aye.
Opposed? Passed unanimous. Number 7, authorizing an agreement with Catholic Charities of the Diocese of Albany regarding emergency and transitional shelter services.
Yeah, this is a contract with Catholic Charities for 2 facilities. One's called Mercy House and one's called Luanga. Mercy serves females and can also accommodate small families, so a woman with 1 child. And St. Charles Luanga is male facility. This is 60% county, 30% state, and 10% federal, for the total contract amount of $972,000 for both facilities. And it does the same milestones and other things that the other facilities do.
Thank you. Are there any questions from the committee? Hearing none, motion to approve. Second. All in favor?
Aye.
Opposed? Passed unanimous. Also, just want to let everyone know, We have these agendas here, which are kind of like sample agendas of what it's going to look like in Granicus. They're still working out some of the issues, some of the technical issues, but if you want to take one of these, there's a few copies, there's 5 of them, to get an idea of what the agendas will look like once we're fully on Granicus. Keep in mind, it'll also be online or on an iPad in that form. So they're right here if you'd like them. Pass them around.
We can get, I only printed out 5 copies just for sample purposes, because we're still working out a lot of glitches with the software, but we're moving, we're progressing towards our goal, and just wanted to show you where we are.
Okay. Can I get a motion to adjourn?
Motion.
Second? All in favor?
Same thing.
Opposed? Meeting is adjourned.